Hi, everybody. Thank you so much for being here for Money Smart Day for the Health of It Health Insurance 101 presentation. My name is Stephanie Amirsoltani. Like Dwayne said, I work here in Student Health Services. I am a registered nurse and a certified health education specialist. I've been in this role for about 2 years, and part of what I love about my job is being able to help students get the ability to take control of their health through learning how to navigate the healthcare system. So that's why I'm here today to talk about a really key component of that, which is health insurance. So I'm going to go ahead and get started. In today's video, we are going to talk about the importance of health insurance, basic health insurance concepts, how to get health insurance, the basic types of plans, and things that you should know about how to use health insurance when you need your health insurance card and things to that nature. On the next slide, we're going to stop real quick to talk about the importance of health insurance. I get a lot of questions of like, why do I need health insurance? I'm perfectly healthy. And that's a totally valid question. And I want to take the time to address some of those things before we kind of hop into a video that overviews how health insurance kind of works. Then we'll break that down a little bit more for better understanding, transition to do more about how to get health insurance, when to get health insurance, and where to get it. Then moving on to some types of plans that you may see, especially if you are about to graduate and enter the workforce, or maybe you're turning, 26 and you have to get off your parents' plan and have to get your own, how you can go about that, and then touch on those key components. So I want to take a second to just address that question of why do I need health insurance? Why is it important? Well, the first reason is to stay healthy. Health insurance gives you access to it gives you the ability to say, like, I have a network of doctors that I can go see for health concerns, and it gives you the opportunity to access preventive care. Preventive care are services like checkups, vaccines, health screenings, and through health insurance, those are actually available to you at no cost. These services help you stay on top of your health and even help you identify any potential issues early on so that if it does become more of a problem or becomes a serious condition, you're actually more likely to get treatment for it or manage it better if you catch it earlier. The second one is to help you save money. Health insurance in the US is really expensive. On average, like a broken leg in the ER, just being in the ER can cost you about $7,000 without insurance. So health insurance helps cover those costs so that you're not stuck with the full bill. And it also makes things like regular care, doctor's appointments, prescriptions, and specialist visits more important. So it helps you save money in the long run. Lastly, it helps you protect yourself, and it protects you from two things. Number one, like I said, with save money, it protects you from those really high medical bills. So like if you break your leg, or if you have an emergency surgery or a serious illness, or even the cost of an ambulance, which can be really expensive and you don't want to pay out of pocket. But also because, like I mentioned before about staying healthy, it helps you catch potential like chronic conditions earlier. It actually makes it, when you identify those things early on, you're more likely to catch up with treatment and catch up with management. So you spend less money in the long run. So you're protecting yourself from medical debt and protecting your health altogether. I'm going to transition now to a wonderful video that I think gives a really good overview of health insurance and how it works. It is about a 4 or 5 minute video, and we're just going to take a few moments to do that. So I'm going to pull that up before we get started. All right. I just want to make sure that that is now up on the screen, that we have that YouTube video up by Consumer Reports.
Yes, we do.
Wonderful. I'm going to go ahead and play. Dwayne, if it does not play or does not have sound, please let me know.
I sure will. We do not have sound.
Of course we don't. Let me see if I can fix that real fast, because we had sound earlier, right?
Yes.
How about now?
How much is it going to cost?
Yes.
Sound?
Yes, sound. We have sound, yes.
Oh. I'm sorry, Dwayne, could you say that again?
Yes, we have sound.
Wonderful. I have to switch my microphone. That's why.
Okay, no problem.
Well, it's not so simple. Sometimes you pay money toward your health care. Sometimes the insurance company pays money. But when? To figure it all out, there are three main ideas you need to know: premiums, deductibles, and out-of-pocket maximum. It may sound complicated, but stay with us. It's not as hard to understand as you think. First, premiums. Think of your insurance as a monthly membership. Every month you pay the same amount in order to be a member. That amount is your premium. With your premium, say $200 a month, you get some preventive care for free. This includes care like vaccines and screening for diabetes, cholesterol, and breast cancer. This care is covered by your premium. But what if you need more than just preventive care? If you need a health service beyond preventive care, illnesses, a broken leg, emergency room visits, you usually need to pay extra. How much? Well, that changes over time. There are three main stages. First, you pay. Then, your insurance pays some, and you pay some. And finally, your insurance pays everything. So how does this work? In the first stage, at the beginning of the year, you pay for most of your health care until you reach your deductible. Remember that word? Deductible. A deductible is the amount of money you have to pay for your care services until you've paid a total of $500. It's like you're filling up a bucket. Once you add enough to that bucket so that you pay your whole deductible, then everything changes. Then you enter into the second stage. Now, every time you get health services, your insurance company will share the cost of those services. How much? That depends on your plan. Usually, you pay part of the cost, fees called copays or coinsurance, and your insurance pays the rest. But the second stage doesn't go on forever. If you reach a certain amount, you won't have to pay for any services. Remember that bucket? Every time you fill it with copays and coinsurance, your insurance company is keeping track. If you fill that bucket up to the top, everything changes again. You enter stage 3. From this point on, your insurance company pays everything for the rest of the year. That's right, every dollar of your health services paid by your insurance company. So what's at the top of that bucket? It's called your out-of-pocket maximum. This is the most money you will pay for your health care over an entire year. So let's say your out-of-pocket maximum is $2,000. After you pay your $500 deductible, and if you pay an additional $1,500 for various health services, you've hit your out-of-pocket maximum. From then on, you don't pay a penny more for covered healthcare services. It's important to know that every year, this starts over. So next year, you go back to stage 1 and need to meet your deductible yet again. So let's review. You pay a monthly premium to get into the club and get many preventive services free. You pay for other services until you meet your deductible. Then, you and your insurance company share the cost of health services. You pay copays or coinsurance, and your insurance pays the rest until you hit your out-of-pocket maximum. After that, your insurance company pays everything. So, how much does your insurance cost? You will at least pay for your monthly premiums, and at most, you will pay for your monthly premiums plus your out-of-pocket maximum. It all depends on the plan you choose and the care that you and your family need. You can get free help from a healthcare.gov assistant to choose the plan that's right for your family.
All right. Can we hear me again?
Yes, we can.
Wonderful. Before I move on, I just want to take a second and see if there are any questions. I don't see anything in the chat. If you do have one, please feel free to pop it in the chat. I'll take some breaks between now and over the next couple slides and answer any questions as we see them. So before we dive into like the different types of things, I just want to quickly, very briefly go back over a lot of the main concepts that were mentioned in that video, including premium versus deductible, cost sharing, and out-of-pocket maximum. So the premium is just the price you pay every month to say I have health insurance. That's a set price. Often that set gets shared by your employer, and it does not count as an out-of-pocket payment. So the premium does not count towards your deductible, nor does it count towards your out-of-pocket maximum. Then once you have health insurance, you have to reach that deductible. And that's just the amount you pay out of pocket before your health insurance starts to cost share with you. They talk a little bit about it in that video about a copay and a coinsurance. And I'll talk about that a little bit too. But the important thing to note is that every year that deductible will reset. So if your plan is from January to January, if your deductible is $500, once you end that year in December, your deductible starts up again in January. That's something really common. People will get a prescription every month at the pharmacy, and then the end of the year hits, or they pay for it and then they stop paying for it because they've reached their deductible or their out-of-pocket max. And then January will hit again and it'll be, oh, hey, you have to pay this time. And a lot of times that throws people off. It makes them a little confused. And then they realize, oh, it's the new year. My deductible reset down to zero. So that's those main differences between the premium and the deductible. I really like the part in the video where it says the premium is the minimum amount that you'll pay, because it's possible that you pay your premium and you have no healthcare costs over the year and you don't even pay your deductible. But the reason that you want to have it, even if you don't use it, is in case there's an emergency. So cost sharing is the next step of that. That is when the cost of your medical care, of your services, it gets covered by your insurance provider and you. And typically that's like an 80%, 20% split where you are paying 20%, but that varies. That copay is like, oh, you go to a doctor and your copay is $20. Or if you see a specialist, it's $30. Or if you see the ER, it's $40. So it's just a set amount that you kind of pay to see that provider. And that's different by plan. It's not always the same number. The coinsurance is a percentage of a cost. So if something costs $100 and your coinsurance is $20, you pay 20 and your health insurance pays 80. And then same thing for if it's 25% or 35% or whatever it may be. Those details can all be found in the summary of benefits of your plan. And something to remember is that, and we'll talk about this a little bit later, something to remember is that plans vary by what they cover, and they also vary by how much of something they will cover. Just based on what plan you have, if you've added any like additional extras onto it or things like that. When we talk about like cost sharing, and I kind of touched on that, like primary care versus a specialist versus an emergency room does have a different thing. I'm going to talk about primary care a lot, like a primary care provider, a PCP. That's your general doctor who, you see for typical reasons. So a primary care doctor, like your general physician, family medicine or internal medicine practitioner that you go to see for your annual physical. Then you have a specialist. Specialists specialize in things. So that could be women's health. It could be a neurologist. It could be a cardiologist that specializes with your heart. So that could have a higher cost. And if you go and see a specialist versus a PCP, there can be different costs for just each service depending on who's providing it. Same for emergency room. Emergency room does tend to have its own cost and copay and different coverages. So we'll talk a little bit about coverage a couple of slides later, but just before, I'm just going to go on to the out-of-pocket maximum to retouch on that and then open up for so many questions. So out-of-pocket max is that maximum amount of money that you pay for the entirety of your health insurance term. So if you have health insurance for 1 year, you will not pay any more than that amount. Your deductible does count towards this, but the same as your premium, what you pay to say I have health insurance doesn't count towards your deductible. Your premium does not count towards your out-of-pocket max. You will always, always, always pay that premium, and the deductible and out-of-pocket max will be separate. It is really important to note that when you hit an out-of-pocket maximum, if you get a medical service that your health insurance provider doesn't cover because it's out of network and you only pay for in-network coverage, they're not going to pay for that. So there are caveats to all of these things, but these are the ways that they typically work. If you have, a plan that lets you get services done, as long as that service is covered, once you hit your out-of-pocket maximum, you won't have to pay out of pocket anymore for it until the next year rolls around and everything resets. I'm going to take a second just to see if there are any questions, and then I'm going to talk about more of the process of where, when to get health insurance and what to think about when it's time for you to start getting your own health insurance. Any questions at this time? All right, so I'm going to go ahead and move on. If you have any questions, in the meantime, or if anything pops up, I'll ask for questions again, or you can pop it in the chat as we go along. So like I said, I'm going to take a second to transition to talking about where to get health insurance, when to get it, and things to consider when it comes to it. So there are multiple different ways that you can get health insurance. One of the most, popular ways, especially among, students or college students, people under the age of 26, is to get it from your parents. You are eligible to have health insurance. You're entitled to health insurance until you're 26 years old. And a lot of people get that from their parents. You go under their plan, and that happens until you're 26 years old. If you, don't have parents, or your parents don't work, or whatever the circumstances may be, there are other ways to get health insurance even before you're 26 years old. So that could be your employer, your school, the marketplace, or Medicaid. I'm going to talk about each of them just briefly. I don't want to go too in depth. But so your employer, like I mentioned at the beginning, your employer can provide health insurance. And a lot of times is your employer will pay part of that cost. And so you're actually paying maybe half of what your real premium is because your employer is paying the other part of it. You can also get it from your school. If you are a student at George Mason University and you need health insurance, we offer a health insurance to students. It is a preferred provider organization. I'll talk a little bit about what that means in a little while too. But if those aren't options for you, if you, are in school and you don't like the plan that they have, or if you don't work and don't have an employer option, you can also get it from the marketplace. This is a federal or state marketplace. I have the link to that at the end of this presentation. But when you go to the marketplace in Virginia, state has its own marketplace. You can see plans that are provided by the state that you can purchase and pay premiums on, and then you can use that as your own health insurance. The other option is Medicaid. That is for if you have a very specific low income. I don't know what the income threshold for it is, but that is something that you can find more information about on the Medicaid website or virginia.gov. So now that I've talked about how to get it, I want to talk about important times when you can get it. Because unfortunately, you can't just decide on a random Tuesday, I don't really like my health insurance plan. I want to change what I have. So there are two main ways that you can get a new plan or make changes to your plan. And the first one of those is open enrollment. Open enrollment happens once a year. It is typically a set time frame. For the state of Virginia, it's November 1st to January 15th. During this time, you can cancel a plan that you have and pick up a new one, or make changes to your current plan, whether it's like adding on out of network coverage or adding dental services or something like that. Now, because that only happens once a year, it is not the only option for when you need to, for changing health insurance. However, there are very specific qualifying life events that allow you to make changes to your health insurance up to 60 days after that change happens. Now, this is a very long list. The list that I have on here is not comprehensive. All of that can be found on healthcare.gov. on the government website for that. But something like getting married or divorced. If I got married and I want to add my partner onto my health insurance plan, I have 60 days from the day I got married to contact my health insurance plan, show proof that I got married, and say, hey, I want to add this person onto my health insurance. But that can happen for a lot of different reasons, having a baby or adopting a child, if you lose a job and need to get health insurance, or when you start a job. So you may not start a job during an open enrollment period, but you have 60 days from the time that you start a job to enroll in health insurance. And that's one of those ways. The list for this is very long. This is not comprehensive at all. There were actually some things on the list that I was like, oh, I didn't know that was a reason that that was a qualifying life event for changing your health insurance. So make sure you do your research on that to see if you're really unhappy with your plan, if there's like something that happened, or if you lost your job and you're not sure. There's opportunities to still do that. You're not just out of luck until the next open enrollment period. I'm going to switch into, talking about very specific health plans, but first I want to also hit on different things to consider when choosing those. I do see that there's a question in the chat, so I do want to take a second to address that before we move on. Dwayne, would you mind?
Not a question, just somebody making a comment.
Oh, okay, wonderful. Wonderful. All right. So with that, I will go ahead and move on to things to consider when talking about health insurance plans. So when it comes to health insurance, there are a couple of things to consider when choosing the different types of plans. I'm putting these out here as just some basic questions. This is not a comprehensive list of things to consider, but it can help you better understand what your healthcare needs are and what you want from a healthcare plan. And then I'll kind of talk broadly about some very popular plan types that you may see over time. So the first thing to consider is your healthcare needs. Are you a generally healthy person that only sees a PCP, 1 or 2 times a year? Or do you have to see a specialist pretty often? If you have multiple chronic diseases that keeps you, bouncing from specialist to specialist, a plan that requires you to see your PCP first or only allows you to see a PCP before you can see a specialist might not be the right plan for you. Same thing about daily prescription medications. How often are you getting prescribed medications? Is it a continuous medication that you take long term, or is it just something that you take here and there because you got sick? So your healthcare needs can impact the type of plan that you want to go with, and we'll talk a little bit about more on that on the next slide too. But I also want to take a second to discuss in-network versus out-of-network. When you purchase a health insurance plan, it gives you the opportunity to say, I have a network of providers. That means that your health insurance plan and these providers have an agreement, have a contract that says, yes, we will take this health insurance plan and provide services for free or at a discounted cost to people who have it. That is considered in-network. They accept your insurance. An out-of-network provider does not have an agreement with your insurance company, and they do not accept your insurance. Sometimes your insurance company allows you to see out-of-network providers, but there will be a higher fee associated with that. Also, you may be able to see a provider that's out of network and maybe your insurance won't cover it, but you can submit a claim to have that reimbursed to you. That's also an option. So when you're thinking about in-network versus out-of-network, think about what is available to you in your general vicinity, what is easy for you to access. Some plans can be location specific, like there can be a very specific thing for Northern Virginia. But if you live all the way out in Fredericksburg, coming all the way to Northern Virginia to like Fairfax, Arlington to get care may not be very accessible to you. So if your in-network providers are not near you, that may not be a plan that you want. So keep in mind always that in-network and out-of-network is going to vary by plan. It's also just a matter of personal preference. If you are okay with just taking whatever, you're not super picky because you don't see doctors that often, maybe you can stay in network because it's not that big of a deal. But also maybe you're very particular about the kind of doctors you want and the doctor that you like that you've been seeing for your whole life, that you don't want to get a new doctor, they're out of network. You can sometimes get that depending on the plan. And the next thing is your preferences. Do you want the ability to see a specialist without getting a referral from a PCP? That is a thing that you can be limited to with certain plans. Do you want to meet a high deductible? There are plans that have very, very, very low premiums. You pay a very low monthly rate, but their deductible is like $4,000 or $5,000. If you don't get sick that often and you're really just trying to, save yourself from, like, if there's an emergency cost, that could be an option for you. And there's other options that go with that, like a health savings account that can help you pay for those things. But so keep in mind that as you're picking plans, a lot of it is personal preference. A lot of it has to do with your own needs and your own desires and wants. But so with that, I'm going to take a second to move on to two of our most common health insurance plans, and hopefully that will give you a better picture. So some really common insurance plan types that you're going to see is going to be an HMO, a health maintenance organization, or a preferred provider organization, a PPO. I'm going to start with HMO. HMOs are typically, when compared to a PPO, have a much lower cost. That is because you are limited to in-network providers. You have to see a primary care provider before seeing a specialist, which contains your costs. And in order to see a specialist, like the prices are just more set. So an HMO limits you to in-network providers. A really good example of an HMO is like Kaiser. Kaiser offers HMO plans, which means you can only see Kaiser Permanente doctors at a Kaiser Permanente primary care provider that you've selected as your doctor. And if you need to see a cardiologist or something like that, you have to go see your PCP in order to access that service, to get a referral. You can't just call up the cardiologist and say, hey, I want an appointment. So because of that, because it limits you to those in-network providers, it's going to contain your costs. And over time, over the course of the year, you're going to pay less money. It's a much more predictable cost pattern. The other type of plan is a preferred provider organization, a PPO. When compared to an HMO, they typically have a higher cost. That's because you have more freedom in whether you want to see an in-network provider or an out-of-network provider, or if you need to see a specialist. With a PPO, you have more flexibility in your care and in your services. So if you want to see a doctor that isn't in your network, the PPO allows you to see that doctor while paying a higher price. Same thing with different services. If the service is provided by an out-of-network provider, you may have to pay a higher co-insurance, like 40%, than if you were seeing someone in network where you would have to pay 20%. So overall, it is a little bit of a higher cost, but it does have some more flexibility. These are two of the most common health insurance plans that we really see. On the next slide, I've listed out a couple of others. I'm not going to go super in depth, but I will talk again about the high deductible health plan here at the end. So some other things you may see are exclusive provider organizations, which are kind of like HMOs, and point of service, which are also kind of like an HMO. I do want to take a second to talk about the high deductible health plan. These plans are for people who maybe don't have a lot of extra money and they still want health insurance in case there's an emergency. This is an option. When you do a high deductible health plan, because that deductible is $4,000 or $5,000, you have an option to do a health savings plan, which takes pre-tax money and puts it into a side account. So if you have an emergency, you've saved up money that you can then pay into that very large bill. So like I said, it's $7,000 on average for a broken leg. If you have a high deductible health plan and you've saved $3,000 in your HSA, when you break your leg and you have to hit that, $5,000 deductible, your HSA has that $3,000 worth of that. And then the additional funds that aren't paid for is covered because you've hit your deductible and your out-of-pocket max. They can be very expensive if you get injured, but it is an option. All of these are options. And you may see other plans that vary from these titles. You may have a gold star plan or a bronze medal plan, and all of that has different details within it. I do want to take a second real fast to just say, remember that every insurance plan is different. This is not the same. The health insurance plan that I have may be vastly different than a health insurance plan my coworker has, just because I've elected to add more things than they have. It's not the same universally. This is just general information about how these things typically work. So this is not universally true. Before picking a plan, it's really important to read through that summary of benefits to understand what services are considered, or what doctors are considered in network, what are considered out of network, what your co-insurances and co-pays look like. And you can get all of that information from insurance providers while you are looking to enroll in health insurance. I'll take a quick little pause to see if there are any questions, and then I'm going to jump into insurance cards just to give a brief overview of that. Are there any questions at this time?
No questions in the chat.
Wonderful, wonderful. So this is a picture of a standard health insurance card. It's really important to take your health insurance card with you whenever you go to a doctor's office or doctor's appointment, because it has all of this very important information. So on your health insurance card, you can see your insurance company, your member ID, the group number, which just kind of assigns you to a specific, like what group of services you're in. If you have dependents, if you have to choose a primary care provider, it'll have your primary care provider. It'll have pharmacy plan information and things like that. And down somewhere on your card, whether it's on the front or on the back, it does typically tell you what your copay is for a PCP, a specialist, or an ER. So for this plan in particular, it's $25 to go see their general provider, $40 to see a specialist, and $100 copay if they go to the ER. The back of your insurance card is also really important because it has phone numbers for how to get in touch with your insurance office if the doctor's office needs to call them for a prior authorization, which is just this whole process of the insurance company saying, yes, you do need a medication. But so having your health insurance card on you is always important. Make sure to bring it to your appointments with a photo ID. And you can also get a lot of the stuff from your portal on your website, on the health insurance website. I always tell people take a picture of the front and back of their card in case they misplace it, just so that if they have to provide their ID number at a doctor's appointment, they're able to grab that quick and easy. But a lot of times, like I said, health insurance companies have apps, they have websites, and you can get all of that stuff at your disposal. Kind of the last thing before we open it up to see if there are any other questions, I just want to provide some, additional helpful tips. Like I said on the last slide, remember to bring your insurance card and photo ID with you to all of your medical appointments. They'll need that to identify you and make sure that you're using your own plan, things like that. Like kind of touched on this briefly, when you get health insurance, there's typically an online portal. You can access that online, you can access it on your phone, but it has a lot of really helpful tools. This is where you can find your summary of benefits. It's where you can see all of your claims. And if a claim has been denied, you can see why it's been denied. But it also has these really cool find a provider services. So if you need to find a primary care provider, a PCP that takes your health insurance, you can go to your health insurance plan website, click find your provider, put in PCP, put in your zip code, and it'll bring you a list of providers that will take your health insurance. If you're not sure if a doctor's office takes your health insurance, you can always check out their website. They typically have like a payment information, and they'll identify the types of plans that they take. If you're not sure, you can always check at the find a provider. You can typically look at providers and practice names by name, or you can call the doctor's office and say, hi, do you take, I don't know, Aetna health insurance? This is my plan, and this is what my card says. And they can generally tell you, yes, we do accept that insurance plan. Please come in, we'll take your insurance. I've said it multiple times, but always, always, always check your summary of benefits before, going into a plan. And even after going into a plan, the more prepared you are, the more able to advocate for yourself you are, the better off you're going to be when navigating the healthcare world. And so our last slide just has some resources. If you're looking for more information and a glossary of health terms, you can go to healthcare.gov. For Virginia's health insurance marketplace, the website for that is coverva.org if you need health insurance from the state. Or if you're interested in getting health insurance through George Mason University, if you're a student here who needs health insurance, you can check out shs.gmu.edu/insurance. And so that is all I have.